let's look at the pancreas. This is a histology slide of the pancreas. I have circled a pancreatic islet, which it consists of alpha and beta cells. Surrounding the pancreatic islet is the acini, consisting of acinar cells. The acinar cells produce and secrete pancreatic juice. The pancreas is considered a mixed gland. It consists of both of endocrine portions as well as exocrine portions. We're concerned about the endocrine portions, or the pancreatic islets mentioned in the previous slide. The islets produce the hormones. Beta cells within the islets produce the hormone insulin. Let's look at the actions of insulin. Insulin is important and necessary for glucose transport into most of your cells. What insulin does is once it binds to its receptor, it triggers a series of reactions that will bring about the placement of glucose transport proteins on the plasma membrane for the facilitated diffusion of glucose into the cell. If receptors are not available for insulin, the cells cannot respond to the insulin and the glucose remains in the blood. In the absence of these transport proteins or the lack of response to the insulin due to no receptors, hyperglycemia will result, increased blood glucose levels. In addition, insulin stimulates or increases glucose oxidation to make ATP. Once the glucose is inside the cell, reactions must occur in order to synthesize ATP. Insulin also stimulates the liver to store glucose in the form of glycogen. The liver also, in response to insulin, converts glucose into triglycerides. Both of these two actions are going to decrease blood glucose levels. Gluconeogenesis by the liver is inhibited because this would do the opposite. It would increase blood glucose levels. So keep in mind that insulin is going to carry out actions to decrease blood glucose levels. Alpha cells in the islets are going to secrete the hormone glucagon. And glucagon is antagonistic to insulin, which means that it will increase blood glucose levels. So how will it do this? By breaking down the glycogen that is stored in the liver back into glucose, and that is called glycogenolysis. By converting amino acids as well as the glycerol of triglycerides into glucose, and this is called gluconeogenesis. If I ask you then, what is the antagonist for insulin? You're going to tell me it is glucagon. Insulin and glucagon help maintain blood sugar homeostasis. There is one imbalance you will be responsible for knowing: diabetes mellitus. Let's break down this term first. Diabetes means overflow. Mellitus means honey. Increased glucose in your urine will increase output. Mellitus refers to the sweet smell or taste of urine due to the presence of glucose. And yes, doctors used to have to taste urine in order to determine whether their patient had diabetes or not. There are two types. Type 1 diabetes is an autoimmune disease. It may be triggered by a viral infection. In this disease, beta cells are destroyed. Therefore, insulin is not released. This leads to hyposecretion of insulin. In the absence of insulin, all of the actions that occur in response to insulin will not occur. Hyperglycemia will result. The second type of diabetes mellitus is type 2. Over 90% of diabetes patients have type 2. Type 2 usually appears later in life and is due to lifestyle or a combination of that and genetics. Type 2 used to be called insulin resistance type diabetes, and this is due to the fact that the beta cells still release insulin, but the target cells do not respond. This could be due to several factors. You could have a decrease in the insulin receptors at the target cells due to what we call down regulation. Recall from the beginning of this chapter that down regulation is a cell's response to a particular chemical messenger or ligand by decreasing the number of receptors. In addition, adipose cells release chemicals such as tumor necrosis factor or resistant. These decrease the response of the cell to insulin even though it binds to the receptor. In this decreased response, the cells will not place glucose transport molecules on the membrane, and therefore glucose remains in the blood. Both type 2 and type 1 will result in hyperglycemia. This figure illustrates the signs and symptoms that are possible with uncontrolled diabetes mellitus.